much I care. My love flows out to you in oceans never ending. And baby, can't you see, oh, I'm in love with you.
Hi, I'm Father Michael Orsi. I am your host for Action for Life Television, that good news program that brings you the big G for the gospel of Jesus Christ and the little g, all the good things that people do to put that gospel of life into action. We have a real live doctor in our studio today. She is an OB-GYN and she specializes in OB-GYN surgery?
Yes.
How about that? Now, over the years, as you know, we have talked about the damage that abortion does to women. And I also talked to you about how abortion also does damage to men. We talked about it insofar as the spiritual damage that's done. That's a no-brainer. Okay? Then we talked about the psychological damage that's done. And let's face it, folks, you do something like killing a baby, there's going to be psychological damage. And sometimes it might not hit the person right away because they have their mind in other places, they're scared, they're worried about what are they going to do if they're in school, or what are their parents going to think, or their boyfriend doesn't want the baby. Believe me, and I've told you this before, I am a Catholic priest and I hear confessions. And people come years later, 20, 30 years later, to confess that they had an abortion, and they're carrying that burden all those years, and it's wreaked havoc in their lives. It's gotten in the way of other relationships, even with their husbands later on. This pain is there. There's also a sense of distance that develops because of what they've done at a certain period of time in their lives. Now, because I am not a physician, I have kind of stayed away from talking to you about the physical damage that can happen to a woman who has an abortion. Now, some of the stuff we know, all of us know that hemorrhaging is one of those bad things, right?
Yes.
Okay, see, even I know that. And I'm just about, drugstore quality. I could tell you to take an aspirin, but that's about it. Okay, we have with us today Dr. Karysse Trandem. And as I said, she is an OB-GYN. She does surgery. And she's also a very talented musician, but she didn't bring her guitar with her today. So, Doctor, I want you to begin to tell us about your experiences as someone who's treated women who have had abortions, or perhaps you've had to intervene after somebody botched one up.
Yes.
That's a technical term, botched, okay? Okay, so you tell us all about all these physical effects. How did you get into OB-GYN surgery? What moved you to get into this field?
Well, first of all, thank you for having me, Father Orsi.
That's a pleasure, believe me.
It's a gift to be with you, and I am in...
You see why I had her here? She's nice to me.
I am impressed just with your fight for life and for the spiritual and physical health of the church, of the people of our world. So thank you. Thank you for having me.
Can I have you again?
And your humor is such a gift too. So I ended up with a biology pre-med degree in college, but as you mentioned, I really love to sing and dance and act and perform, and so I pursued a career in the performing arts in New York City.
Really?
Yes, directly after college.
Where'd you go?
New York City.
What school?
My school was Bethel University, but I was after Bethel in Minnesota. That's when I went to New York. So I loved my time in New York. I just love the city. But all the while I really was praying, God, lead me according to your will for my life. More than what I want what you want for my life. And I felt the Holy Spirit really telling me, medical missions, I want you to be a medical missionary. And I thought that meant being a surgeon in Africa or something like that, which is beautiful, and that's what I was planned to do. But ultimately, when I went to medical school and delivered my first baby, it was such a miracle. That little life and that first breath, it is the breath of God that fills those little baby lungs, that first moment of life outside of the womb. And I really ultimately came to the conclusion that God was calling me to be a medical missionary for the unborn. And so I did go on to choose OBGYN as my specialty.
A medical missionary for the unborn. I mean, this is even a new one on me. I never even thought about that, but continue.
Thank you, praise God. So I completed my residency training after medical school at the University of Minnesota, great training program. But as you may know, the American Academy of OBGYN is a very liberal, pro-choice organization.
How could you be liberal, pro-choice, and you're OBGYN? I mean, you're supposed to be bringing babies into the world, and they're killing babies. That's an oxymoron. I got up to the O's this week. Go ahead.
Yes, it is. It truly is. And the vast majority of OBGYNs do not perform abortions and do not agree with pro-choice concepts, but the overarching American organization does. And so a lot of the thrust in training OBGYNs is to train them also how to perform abortions.
But do you have to go to that training?
I had to go to the abortion clinic, and believe you and me, I prayed on my knees every day for a long time before I would step foot in these clinics. And it's just so sad. You can just feel the death and the sadness in these clinics. So I did have to go to the clinic, but I went as a prayer warrior, and I didn't have to participate in any of the abortion procedures.
Wow. Oh, thank God. Thank God for that.
Yes. So having had that intimate experience of how women are treated and what they're told and not told at an abortion clinic. And then, as you mentioned, also I've treated now in my career tens of thousands of women, and sadly, 1 out of 3 women in America have had an abortion now since.
Folks, 1 out of 3. 1 out of 3. Could you imagine this? And yet there's an administration in Washington that wants to have more. I'm sorry, Doc, but please continue, because this is, to me, unbelievable.
It's truly unbelievable, and it really is a genocide of our day. So I have, as you mentioned, I have treated women who have had abortions at Planned Parenthood that had hemorrhaging afterwards or other significant uterine damage and wasn't able to get any care back at Planned Parenthood. And so I have operated on multiple patients who have had severe complications after having had an abortion. And then I've seen personally not only the emotional distress in these women and in their husbands or partners, but also other physical distresses, which I'd love to tell you about.
We want to hear them, but I want to tell our folks, you said that when you were training, you had to go to an abortion facility, but you were saying your prayers, you weren't doing anything dastardly, okay? When a girl goes in there, I mean, what do they say to her? Mm-hmm. Come here, sweetie. I mean, what do they do?
Yeah, it's, in my experience and my training, the women were brought in to sign a consent form for the abortion. They weren't giving any counseling, any option of adoption, any counseling to the risks, which I'll tell you about. There was no counseling.
So they got to sign something, and there are risks involved, but they're not told of the risks.
That's right. That's right. And at that time, the doctor performing the abortions was not in the room when the patients were signing the consent to have the abortion. And then the patient was just taken immediately after signing papers into an office room with surgical equipment, and the abortion was performed. But so the woman will be placed on a bed, and then with her feet in stirrups, and then there are instruments placed into her vagina, and then the patient's cervix, which is the opening of her womb, the opening of her uterus, is artificially dilated with metal rods in order to open up to a portion of the dilation required to deliver a full-term baby.
Is this done by the doctor, supposed to be a doctor, right?
Yes.
Or is this like a nurse or some technician? Who does this?
That should be done by a doctor, yes.
And does Planned Parenthood, for instance, do they have doctors, or do other abortion clinics have doctors, or do they have some other people that have been trained to do this kind of work?
I believe Planned Parenthood uses doctors to perform a surgical abortion, but to perform a medical abortion, they do not require a doctor visit with the patient.
Okay.
So the cervix is forcefully dilated, and that disruption of the muscular wall, the tight seal of the cervix, can permanently damage the cervix. And that's part of what I'll talk with you about in the future for risks for women who've had an abortion. Once that cervix is dilated wide enough in order to fit a straw, a vacuum straw, that straw is placed into the uterus. It's also technically called a curette. So this is a dilation and curettage, a D&C. So the vacuum straw is used at a very high power vacuum suction to remove the contents of the uterus, including the baby, the living baby, and the placenta.
Let me ask you, doctor. Okay, I get this. You put the straw in, and then it's like a vacuum cleaner, right, I guess. But I mean, is this for all sizes of babies? Because babies come like from a couple of weeks to like almost 8 or 9 months. All right. Does that? I can understand how it works on the younger fetus, but what happens as they get older? 6 months, 5 months, 6 months.
Yes, so the D&C procedure is the most common in the first trimester. In the second trimester, there's a D&E, dilation and evacuation, where the abortion doctor will remove pieces of the baby using a forceps, an instrument that grasps whatever it can inside of the uterus. This is either done blindly or with an ultrasound on top. And the doctor will pull limb by limb.
Ladies and gentlemen, do you hear what the doctor is telling us? Do you hear this? Pulling the baby apart, limb by limb.
Yes, you're right. It's so sad, so tragic. And then that process is finished with the skull, and the baby's skull is crushed. And we know that babies can feel pain, and so they are feeling this procedure. That's in the second trimester. And as you can imagine, the fetal parts are then collected and put together to form sort of, a detached baby, to make sure that the abortion doctor has removed all of the baby parts. And that's just truly, truly sad. And then in the third trimester, if this state allows the baby to be aborted in the final last months of the pregnancy, that's often done by inducing labor, as would be done for a normal, healthy baby, just like these are for women who needed an induction for some kind of medical reason to have their baby a little early, and the baby would be born alive. In the third trimester, it's very similar, where a woman would be given medicine to cause an induction of labor, and the baby would be delivered typically by its feet first, and then its body, and then a abortion doctor would cut the spinal cord right at the base of the baby's skull before delivering the baby's head.
I tell you, folks, I think I'm going to cry over here. All right. Let's go to the last, partial birth.
So, yeah, That partial birth abortion is just this when the birth has occurred, but then the doctor will, right before the head is delivered, kill the baby by using a scissors to cut right at the base of the spinal cord, at the base of the baby's skull. And then even in New York, a baby can be born alive, and now that law has passed where once the baby is alive, a parent can choose to kill the baby once the baby has been alive.
Could I ask you, how do they kill the baby once the baby's alive?
I don't have the exact details on that, so I can't
Thank you.
tell
I'm glad
you
you don't have the exact details on
Yeah.
that. All right, ladies and gentlemen, I mean, this is gruesome. I'm sorry, that we have to tell you this, but you should know. You have to know what this is all about. Some people just don't get it. I had a woman say to me a couple of years back, "What do they mean by partial birth abortion? It's so inconceivable," and yet you heard Dr. Trandem tell us, what happens at different stages of fetal development. As you can imagine, producing this wonderful program, Action for Life, it costs a great deal of money. We're going to need your help. So if you would like to donate to keep this good news program on the air, please go to your computer, your cell phone, actionforlife.net. And now for our thought for the day. Prayer is extremely important. We're not fighting a battle just against earthly powers. We're fighting a battle against evil. Please take some time each day to pray and ask God for the strength that you need and that we need to keep up the battle for life. Now tell us some of the complications that set in with some women. I'm sure, it's more than one or two women that suffer.
Yes, that's true. So I, as a physician in my medical school, I was able to perform research at the National Institutes of Health in Washington, D.C., and then in residency at the World Health Organization in Geneva, Switzerland. So I am very familiar with how research is performed, how to comb through research and make sure studies are done scientifically and appropriately. There's different levels of research. And in my career, I have researched hundreds of articles and come up with these statistically significant risks of abortion. And there's 4 major risks.
Okay, we're going to hear now the 4 major risks. And you have the statistics on this.
Yes, and these are from worldwide studies, not just in America, but in Europe and China, in other countries in our world that agree, all of the research studies agree. So the first is a risk of breast cancer. Women who have had just one abortion have a 30 to 40% increased risk of getting breast cancer in the future. So before Roe versus Wade was passed, 1 out of 12 women got breast cancer. After Roe versus Wade was passed, 10 years later, which is when we begin to see cancer develop, it's about how long it takes for cancer to develop, 1 out of 8 women now get breast cancer. So directly related to their abortion, it's the most significant risk factor for a woman to develop breast cancer.
Isn't that amazing? We hear so much today about, breast cancer and go get your mammogram and it could be genetic and all this stuff. Well, yeah, maybe it is genetic, but maybe it's not. Maybe it's because something else happened along the way.
Yes.
Before the cancer developed. You know, ladies, please pass this on to your children, grandchildren, and nieces. Let them know. You know, I wonder why don't they teach this in school? Well, as a matter of fact, I kind of know why they don't teach it in school. It's not PC.
Yes, it's true. A lot of this is known research, even at the National Institutes of Health. But when doctors try to bring it up at the national conferences, when they make a decision if they're going to share if breast cancer is related to abortion, they're immediately shut down because a lot of the funding for the National Institutes of Health comes from a specific source, a pro-choice source. They have an agenda that they're trying to uphold based on funding.
And ladies and gentlemen, a lot of the funding is coming right from this country. The President of the United States once again joined WHO, World Health Organization, and is promoting abortion as women's health care. Well, doctor, already we found out that that's number one baloney when it comes to women having abortions, now more susceptible to cancer, breast cancer. Next, tell us some more.
Yes, the second most common problem is a risk of preterm birth in the future. So we know that in the US alone, there are over 11,000 babies born and die the same day each year because of preterm birth. The preterm birth rate has increased 100% since Roe versus Wade was passed. 100% increase in preterm birth rate. Now America, which we have the best medical scientific studies in the world and power in the world, but we're the 6th highest in preterm birth rate.
I never heard this. I never heard this before. So that if some woman had an abortion in her past, and then decides later on that she does want to have children, maybe she gets married, has the time to have kids, and she's really endangering future pregnancies.
That's exactly right. That's exactly right. And I have treated countless women who this has happened to, where they've had a surgical abortion in the past. And as I mentioned before, that can damage the muscular wall of the cervix, so it never can tighten like it should. So women who have had one surgical abortion have a 36% increased risk of having a preterm birth. And if they've had 2 surgical abortions, they have an over 90% increased risk of having a preterm birth. And that can lead to, permanent fetal damage, scarring, a lifetime of a sweet life who's been damaged because of preterm birth, or death, fetal death.
It's a lot of baloney when they go out there and tell you, you have a right, it's for your own health. It's not for your own health, and certainly it's not for the health of not only the baby that's aborted, that's over, but for future children. Do you understand what I'm saying? Okay, let's hear the next one that nobody ever hears about.
And third is mental health problems. As you mentioned, you have personally heard the heartache of women crying out about their past abortion. Statistically, if a woman has had even one abortion, they have an 81% increased risk of having a lifetime mental health problem, depression, anxiety, post-traumatic stress disorder, shame, and that leads to a 6 to 7-fold increased risk of suicide in these women who have had one abortion.
You never hear about that in your health education classes, do you? Now, as I've told you many a time, this is not just for Christians and Catholics and religious people. This is for everybody. And I always tell you, get involved in the schools. Make sure you know who is on your school board and get correct curriculum taught in those schools, not the baloney that's being passed out by the far left-wing people who want to take over not only our minds, but our bodies too.
Yes.
They want control of our bodies.
Yes, you're 100% right, Father.
And because they don't want to, increase the carbon footprint with more people. Give me a break. Okay, doctor?
And then the fourth major risk factor is uterine damage. So as that baby is pulled away from the wall of the uterus, whether it's done by a pill, a medical abortion, or a surgical abortion, either way, that causes an internal hemorrhage inside the uterus, an internal hemorrhage that makes the baby and all of the tissue associated with the baby rip away from the wall of the uterus and be passed through the cervix. That hemorrhage can continue and lead to a severe problem where a woman needs blood and needs additional surgeries, and that can even lead to death. And also that can lead to scarring on the wall of the uterus and an inability to be able to become pregnant in the future. I have many patients who have had one abortion and never could get pregnant again, see me with tears and say, why didn't anyone tell me this would change my entire life?
Let me ask you something. If you could do that to a baby, and you could do that to a woman, knowing all the complications, don't you think some of us older folks might be next? Or some of us folks who are challenged physically or mentally in some way, don't you think so? I mentioned earlier today that what takes place is almost like Dr. Mengele in the Third Reich, reassembling body parts. It's horrible. It's horrible. Are we reliving the Third Reich today, even in the United States of America, which guarantees life, liberty, pursuit of happiness? Life, basic. Is the baby free to die? No. People made that choice to kill the baby. Happiness? Who's happy? Nobody. The baby's not happy, and the mother's not happy. And you know what? The whole family, no matter what happens later on, that unhappiness is going to follow from generation to generation. Believe me when I tell you this. So, Doctor, I am so happy that you were here with us today. I know we're going to have you back because you're going to come back and you're going to talk sometime about another group that you belong to, because you're the founder and CEO of Canopy Global Foundation.
Yes.
We're going to talk about that. You're wonderful. God bless you.
Thank you. God bless you too.
Thanks for being here.
Thanks for having me.
Well, ladies and gentlemen, as I do every time we complete a program, I remind you that I'm for action, and I hope you are too. We would like to thank our generous sponsors for their wonderful support. Thanks for watching. Please join us next time for Action for Life. I'm for action, and I hope you are too. I'm Father Michael Orsi. I am your host for Action for Life Television, that good news program which talks about the gospel of Jesus Christ, the big G, and the little g, all the good things that people are doing to put the gospel of life into action. So please join us for the next episode of Action for Life.